Welcome to Brain Wellness, the podcast. I'm your host, Mandy MP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So, let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Dr. Shane Creado. He is a double board certified sleep medicine doctor and psychiatrist and practices functional sleep medicine, integrative psychiatry, and sports psychiatry. After seeing some of the other experts that are out there in sleep, he was inspired to write the book Peak Sleep Performance for Athletes. And it debuted as #1 in sports medicine on Amazon. He's also a contributing author to 6 principal books on sports psychiatry, has remained at the forefront of sports psychiatry for several years, and it was on the co-author as the first international consensus on sports psychiatry in 2024. He's consulted with multiple individual athletes and organizations. He also consults with the Amen Clinics and is the host of the Overcoming Insomnia course available on Amen University, which teaches the best evidence-based strategies to improve sleep, and has designed a best-selling personalized sleep supplement line for Brain MD. He has also, again, consulted with multiple organizations, including PGA Tour Europe, NBA Players Association, the Australian Football League, the U.S. Olympic and Paralympic committees, and many, many more. I will include the entire bio in the show notes for you guys today, but I do want to get into conversation because I'm really excited to talk. So thank you so much, Shane, for being here today.
Thank you, Mandy, for having me. It's an absolute pleasure.
Yeah. My first question to everybody always is, what got you here? What got you to what you're doing today?
My faith in the Lord, and I started off with not knowing what I wanted to do career-wise. And my maternal grandfather had a stroke when I was 15 years old, and visit him at the weekends and see the PT working with him every weekend. I said, that sounds cool because I like healthcare. I was pretty much only good in biology and history, hated everything else. And so I went to PT, and it was very fulfilling, very rewarding. And I just felt I need to do more with my patients who were struggling with spinal cord injuries and cerebral palsy and strokes, were depressed or anxious, and they were not doing therapy at home because they were so depressed. And I said, I'm inadequately equipped to deal with that, to help them out and to spend 1 or 2 hours with them and they're telling me about all their problems and their struggles in life. I felt ill-equipped. So I said, let me just go to med school and become a psychiatrist. So I did that in Madison, Wisconsin, the University Hospital Clinics and the VA. Love working with the veteran population as well. And even in psychiatry, I realized we were not really addressing sleep problems independently unless, it was Ambien or something. We're not screening them for sleep apnea. And we know that there's a 20% overlap between sleep apnea and treatment-resistant depression. I can go through every major psychiatric diagnosis. There's a major sleep component that were not being adequately treated. So I said, this seems awful and I'm doing an injustice to them. So I went on to do a sleep medicine fellowship, and simultaneously I got my feet wet in sports psychiatry and even in elite sports. They're focusing on physical training, which is great, and healthy nutrition, personalized nutrition, but they were not using sleep strategies in the context of supporting athletes' mental health, but also in terms of performance optimization. And so I said there was a huge need there. I felt there was a huge need there. Really started digging in deeper. Honestly, Dr. Amen contacted me after I finished my sleep medicine fellowship and said, hey, you've done all these things. It sounds like you take an integrative approach to life, to your career. Would you like to join my Chicago clinic? It was opening the same year. And I said, perfect, let's go. And here we are, 8 years on. It's been an absolute blessing to be a part of this experience and learning so many more integrative tools that I was not taught in PT school or med school or psychiatry or sleep medicine. So that's where I am. We're on the same page with what's motivated us and driven us to help other people learn in the process. What a privilege, what a joy.
That's a great way to kind of get through all of that. But you have learned so much along the way from all those different areas. And we've talked about sleep probably 1,000 times on my show, and I talk about it day in and day out with my patients. But from your perspective, why is sleep so important for our brain's health?
Well, if you look at the Bright Minds risk factors for brain health, the Dr. Amen always speaks about, it's an acronym, right? B in the Bright Minds is for blood flow, R is for retirement and aging, I is for inflammation, D is for genetic predisposition, H is for head injuries, T is for toxin load, so on and so forth. Sleep problems affect every single one of those bright minds risk factors. And when I talk about sleep problems, we know it's not just not sleeping enough, it's the timing, the quality of the sleep that you're getting. In other words, sufficient deep and dream sleep. And there are good reasons why each of those are important. And then the total sleep need for the given individual. Duration, quality, timing are each independently critical in supporting your brain health. So that's one piece, each of the bright minds risk factors. The other piece is that each one of those risk factors can cause downstream effects, like concussions and sleep, big overlap. Each of the mental health issues and sleep problems. So direct impact of depression on sleep and vice versa, anxiety and sleep, PTSD and sleep, ADHD and sleep problems, substance abuse and sleep problems, bipolar disorder and sleep problems. So there's a brain health component, but then there's a mental health component, and all the feeding saboteurs of brain health, which have a direct correlation with sleep.
Yeah. I had a patient recently that we were talking about all of the different things that he could do to get better. And he said, well, isn't there one thing? I'm like, okay, if you do nothing else, I need you to sleep. So literally. And he said, okay. He told his wife, write that down. If I do nothing else, sleep. I'm like, that's 100%. I need you to sleep more than anything. So why do we see slower recoveries from injury? And for example, if people aren't sleeping?
Well, okay, so you're talking about injury as in head injuries, right?
Yeah. Yeah.
Okay. Well, what happens is after someone's had a concussion, meta-analyses are the largest kinds of studies that they do out there where they pull in different studies and they say, well, this is what the consensus is or the data shows. So there was a meta-analysis of over 1,700 studies looking at TBIs and the impact on sleep. We find that even with one head injury, and how do you diagnose a head injury? You bumped your head and might be a head injury, but you're not diagnosed with one. But for those ones that were diagnosed with head injuries, they found there was 50% of those people had insomnia. The sleep apnea rate prevalence went up 24 to 36% compared to the normal population's sleep apnea prevalence being 4 to 10%, depending on the study you look at. Circadian rhythms were completely mismatched or disrupted. Their deep sleep was compromised and their dream sleep was compromised, what we call sleep fragmentation, because maybe their nervous system has gone into danger mode for various reasons, impact of concussion, whiplash, damage to the neck area. And so with all those things, basically, if you're not getting quality sleep, you're aging every brain cell. In fact, other studies have shown that if you're sleep deprived a certain amount of time, the brain starts eating itself. So if you are concussed and you're not using sleep as your anchor, like you rightly suggested to your patient, you're delaying your recovery, prolonging brain damage. You're risking not screening for other comorbidities that have now developed, like acquired ADHD, which can cause a scatterbrain, difficulty falling asleep or staying asleep. It can cause pineal gland damage, which regulates your melatonin. It can damage your pituitary as well, because it's a very thin stalk that supplies the pituitary gland. It can disrupt your hormones, which can fragment your sleep. And then that's what's going to cause a delay in your recovery because your brain is not getting the deep sleep it needs to flush out the toxins that build up through the lymphatic system. That was only discovered like a decade ago, which is mind blowing, right? And then dream sleep is an issue for memory consolidation. So if you're not doing those things, your recovery is going to be delayed. But not only that, you add to the different areas that are damaged with concussions. The most commonly damaged areas are the prefrontal cortex, the frontal lobes, and the temporal lobes, the sides of the brain, right? Now, if the temporal lobes are affected, your mood is going to be more unstable and your memory is going to be compromised. To be quicker to react, quicker to be hijacked by your emotional hijackers. What does that look like for you? It means that your brain's sleep is going to be disrupted, your stress hormone levels, cortisol are going to go up. Long-term elevations of cortisol lead to shrinking gray matter volumes in the brain. So meditation has the opposite effect. Then you're going to look at adrenal fatigue down the line, then chronic fatigue. Then you're going to sit and get more depressed. Then you're going to want to eat more. For every 4 hours of sleep that your brain loses, it thinks it needs 900 more calories. And that includes sleep quality. So if you have crappy sleep quality over one night, 900 more calories, and it's usually junk, right? We're not going to want to eat celery sticks. I mean, that would be nice, but that's not the way it works. You're going to look for the sugar because it's more addictive than cocaine. I don't know what that feels like, and no one should. It's bread, sugar becomes sugar, and then you want more. So it creates this unhealthy cycle, and then more weight gain. Every fat cell in our body is pro-inflammatory. Inflammation damages blood flow to the brain and damages the long-term brain health and worsens your concussive picture and delays your recovery. So you see, it's it's kind of like a snowball effect that ends up like an avalanche that destroys your brain health. And some people never recover from their head injuries.
And as you were going through that, it kind of reminded me too, the way that you got stumbled into all those different areas of medicine to begin with. Not We can't practice in silos because, as you mentioned, all of those things are related. Your hormones, your sleep, your mood, your nutrition, your cortisone, everything, all of those are related. And we have to look at that big picture when we're seeing patients.
You're 100% right. And that's exactly what you're doing, which is why I admire your work, because you're bringing all these resources together for people and allowing communication, the dialogue between the experts that can provide supportive care. We're all a team at the end of the day.
Yeah. Before we hit record, I was talking about how I even found out about Amen clinics, and it was through Dr. Schaller, who was a previous guest on my show, and he offered that same information. He said, "We're a team. I don't see you as a competitor in this," and I love that nature of practice because that's how we all grow, and that's how we can all make this better for everyone.
100%. We have to fulfill our Hippocratic oath. Otherwise, as I like to say, we're fulfilling a hypocritical oath.
Absolutely. Absolutely. So, what are some of the ways that we can, other than maybe sleep, other ways that we can optimize our brain health?
Well, I think about the bright minds risk factors on the brain health front and blood flow. Look at underlying factors for blood flow, like high blood pressure or low blood pressure, cholesterol issues, low iron or anemia, because iron is needed to produce red blood cells, which are needed for oxygen carrying capacity of the brain. Look at toxin load. I mean, what isn't toxic? We're inhaling 7,000 nanoplastics a day. Our water is full of fluoride, which is neurotoxic, and atrazine, which can mess with your hormones. And then food is sprayed with appeal and all this other stuff. So eat clean organic as much as you can, grass fed meat. If you're not vegetarian or vegan. Also, try and cook in avocado oil or beef tallow rather than seed oils. I could go into those reasons, but for brevity's sake, avoid things that are toxic. Think Dirty is a good app. It's a free app that can scan your personal products for toxic load and gives you good alternatives. Or deodorants, for example, can block hormone production or receptors. So our air, our water, I use reverse osmosis now. If you're feeling kind of inflamed or fatigued or lethargic in cycles, if you've disrupted digestive issues, I'd say every 6 months, do a little detox, do a little mold detox with cholestyramine or Welchol, do a little parasite detox, send parasitic medications, kind of like jumpstart your metabolic system. And also do a mitochondrial boost. So typically you do that with, again, avoiding sugars and alcohol as much as possible, optimizing your sleep. But then also more of the keto diet, or if you can't do the keto, at least do maybe a water electrolyte fast for 40 to 72 hours. You jumpstart those mitochondria because they're like on-off switches, right? Either switched into fat burning or fat accumulation. But the fast allows you to have what's called autophagy, where the unhealthy cells gonna die out, the zombie cells, and then you have new mitochondria and healthier cells kind of revving up your metabolic rate. Those are a few basic things: the water, the food, the toxic load we're putting into our system, and then ruling out anything else that may be damaging us, especially negative people, low energy, um, high stress environments, toxic interactions. So there's a fine balance between pushing ourselves to challenge ourselves and grow. One of my mentors in psychiatry is a psychoanalyst from Harvard, and he taught me dream analysis. And he once said, Shane, life is as simple or as difficult as pushing away what hurts us and pulling in what protects us. And I was like, oh, I didn't think much of it. But years later, I thought about it. As simple or as difficult? Well, if we push away everything that we think is going to be harmful, how are we going to grow and learn? Our cocoon of safety becomes our cage of imprisonment. But then if we have no boundaries as well, then we're vulnerable to attack, and then we're just putting out emotional fires all the time. And we can't really grow into our sense of identity. We're just fulfilling roles and becoming people pleasers. And the evidence bears this out as well in my readings after that over 10 years ago. Where are we at with how rigid we are versus how adaptable we are? If we're too rigid, we're going to push people away and be isolated. If we're too adaptable, we end up like a balloon animal bent out of shape and we don't recognize ourselves. So, social connections are critical for brain health.
Do you ever see that patients have difficulties finding those lines of where to be flexible and rigid after they've had some sort of insult to their brain, whether it's a stroke or a injury.
100%. And the reason is that the frontal lobe may be affected. That helps you with willpower, suppressing impulsive thoughts or words, and forethought. It's kind of putting the brakes in the emotional brain. And then the emotional pendulum, which is controlled by the temporal lobes, may be swinging too wide. So you might get easily emotionally hijacked. You might not pick up on social cues. Emotional awareness drops for the frontal lobes after head injury. So you become more reactive, shorter fuse, difficult to pick up on social cues. You have less forethought, so you might speak your mind, which may not always be ideal because you don't think about the consequences as much. And so that involves a bit of relearning some of those boundaries, those healthy boundaries, not even coming to the fact that, each one of us is kind of determined predominantly by the role we have in a given phase of our lives. So when I was in med school, I had no social life. I was like, my identity was a medical student. Right? Same goes for people who are husbands or wives or parents. And then that takes away from your core identity, who you are, what your core values are. So that disconnect can also lead to someone compromising their innate boundaries or values or principles. And I started telling my patients who are dealing with emotional hijackers, I've told them, well, you can either try and push them away, and I'll tell you, let's get rid of your anxiety. In this session, first session, you never have to see me again. What, really? How? Well, get rid of everything in your life that makes you anxious. How's that? They think I'm crazy, right? Because we get anxious about the things we care about the most. So, how can we use our emotions? Maybe we can use our emotions as teachers instead of hijackers, right? And maybe when anger comes to our door, welcome them in and say, have a seat, anger. Tell me what you're here to teach me. Maybe a boundary was breached or a value was compromised or an expectation wasn't met. Thank you, anger. So then you shift the frame, right, from the emotional hijacking frame to the teaching, learning, growth frame. Then you're shifting from a judgment perspective to a more learning perspective, a feedback perspective from a failure perspective.
How do you get patients to get on board with that?
Really, you see their eyes open, pupils dilate, and then I'm going to try that. And it's fun, it's not about, oh, you have to do all these things for your brain health and your sleep, and you're doing all these things wrong. That's 50% of the analysis. 50% of it is seeing what you're doing right. And 50% is, filling in those gaps and then having fun with it, like an adventure. Dip your toes in the water of uncertainty and hold them there. See what happens.
You said something else that kind of struck a chord too when you were talking about how if we're around all these anxious people, we'll be more anxious as well. And it reminds me of the saying, I cannot remember where it came from, but you are the sum of the 5 people you spend the most time with.
Yes.
And so if you surround yourself with anxiety, you are going to be a little bit more anxious too.
Yes, it's difficult because if you just surround yourself with anxious people and, birds of a feather flock together, then that becomes your default. And then where's your compass? It's not like everyone's wrong or I'm the only one who's right. That's narcissism. But where is your perspective helping you achieve your goals and where just perspective sabotaging your goals? So I have CEOs, billionaires I've worked with who are high stress individuals because that's what it takes to run businesses and companies and deal with the shocks in the water every day. But when you go home to your wife, you can't really be a CEO at home. It's not really going to work out well for you. So it's all perspective, right? In this situation, in this perspective, this makes sense. If I'm in a war zone, of course I need to be anxious, otherwise I'm not going to be alive too long. But outside of the war zone, when I come back home, that's what PTSD is. You get stuck in that danger mode, survival mode. How do you switch it off? How do you modulate it? And are you right or wrong? You can both be right. Thing is, does it work for you at that point in your life or not? And then set your sails toward that trajectory, that next goal. And guess what? The goalposts are always going to shift in life, right? That's my goal. Well, it's just going to be like a mirage on a highway, on a desert highway. It's just going to go further and further away. So your goals may change. Your perspectives may change. Look at what happened in your life and mine. I had this goal with a career and then I switched and it switched and it switched and it's going to keep just switching.
Yeah. Yeah. That's when I first went to college, I thought I was going to be a music major. And then I realized that was not where I was going to be able to support myself financially, at least. And then I got into nursing, fell in love with neurology pretty quickly. But I said before we were recording, I was a stroke provider for years and years until I had my own TBI, and that shifted my perspective. So talking about how goals can change over time. I thought I had this whole plan very well. And you also mentioned faith at the beginning too. So the best way to make God laugh is to say, I have a plan, right? Because something always changes. You have to be able to work with that. And the biggest thing that I found in my own recovery was trying to find that silver lining. I always said that things happen for a reason, and you don't always know the reason right off the bat. And it took me a while to find that reason. But when I finally did, if I hadn't been in my car accident, I wouldn't have met people such as yourself. And I wouldn't be doing the work that I am in concussion now. So there's a reason for it. It's a crappy thing that happened, but so much good has come out of this.
Oh, I love that. It reminds me of Viktor Frankl and his book, Man's Search for Meaning. And purpose is what drives us toward meaning and value. And maybe that's what happiness is. If people come to me, patients, and say, I just want to be happy. Like, that's a lofty goal. Let's work on being less miserable first. Happiness tends to be a consequence of purpose and meaning. Just like laughing, as you just did, is a consequence of maybe something funny being said. So it's interesting how we can shift our perspective and into a whole learning frame, and then it becomes curiosity again, the way we were when we were toddlers, crawling around. Yeah, toddlers are really cool. Let's be honest. They can't even walk. They try and run. They want to explore their surroundings. They've seen a socket for the first time. They try and put their finger in it. Don't recommend doing that. But, toddlers are challenging themselves constantly, and we seem to have lost that along the way. And guess what? It helps with neuroplasticity and brain healing. So why ever not? Push yourself out of your comfort zone. Everything's risky. Crossing the road is risky.
Yeah. Walking out of your house, staying in your house, either of those can be risky. So it reminds me of other memes that come across too. And marriage is hard, divorce is hard, work is hard, not working is hard. You got to choose your hard. So find that risk that's calculable and figure out which one is the better option for you.
Yeah. And guess what? It may not always have been the better option, but you put yourself out there. One of my friends is a mountaineer. He keeps hiking, going the Alps, and he wants to Kilimanjaro this year. And you're saying, Shane, I think about life the way I do mountaineering. He said, you're training at base camp for a while, for a few weeks with other people. Some people will quit at base camp. Some people may make it to the first stop or the second stop, or maybe you hit an ice wall and you realize you can't go any further. And then maybe there's an avalanche, or you just stay overnight and then you don't have food to eat one night. And then maybe you say, I can't go up any further. Maybe I should need to go all the way down the mountain around and then maybe do that, or just call it a night and quit. And maybe you will reach the summit. Maybe you won't. Maybe you'll reach the summit and there are people you never thought you'd end up with or meet. They're the summit with you. And that summit is going to be different for each person. That journey is going to be different for each person. And yet you push yourself. And guess what? When you push yourself, the medial cingulate gyrus develops more gray matter. It actually develops resilience. The more you push through, the more resilience you develop.
I think sometimes we forget about that. We think that if we're pushing and we're failing, that we're not going to gain anything from that. But I made my husband laugh the other day because I said failure is first attempt in learning. He's like, well, what if it's not the first attempt? Well, then it's the second attempt, whatever. We'll call it something else, but it just helps you learn. And a lot of us forget that.
Yeah, I love that. The Japanese have a saying. They say, I don't know what it is in Japanese, but they say if you fall 7 times, get up 8 times. It didn't make sense to me because unless you're on the floor first, how are you going to get up
Yeah.
8 times? But the concept is clear, right? Get up. The only difference between success and failure is not trying.
Yeah. 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 So speaking of journeys, if I hadn't been on this journey, I wouldn't have learned about Amen clinics. And I'm realizing that many of my colleagues do not know about it. As you are working at Amen, seeing patients, what does it look like when somebody comes to you?
Absolutely. So Dr. Amen is a psychiatrist and he got involved in SPECT imaging, which is basically different from CTs and MRIs, which look at pictures of the brain for things like bleeds and tumors and cysts. These SPECT images look at blood flow and activity in different brain regions. And based on the neurology, the neuroscience through the decades, we know what brain regions are supposed to do. So rather than just say, well, you meet criteria for major depressive disorder, here's some Prozac, we say, okay, well, these are the brain regions that are affected. They help with these functions, so you might be struggling with these issues. Okay. But what are the things that damage each of these brain areas? Integrative stuff, right? So the frontal lobes can be damaged by sugar, fast carbs, seed oils, low vitamin D, low iron, which needs to make dopamine, lead, which blocks dopamine production. Let's look for those things since your frontal lobes are not working properly, right? Sleep problems affect the brain regions that concussions do. So untreated sleep apnea is like concussing your brain. So we look at those different brain regions. We bring integrative psychiatry to neuroimaging, and then we work on a comprehensive plan that may involve medications for more serious issues like bipolar disorder, schizophrenia, but also a lot of mostly non-medication strategies, personalized optimized sleep strategies, nutraceuticals or supplements, saunas, hyperbaric oxygen, based on the need, right? So there's common elements because we're all human beings with brains, certain things that damage the brain, certain things that help the brain universally. And then on top of that, we build very, very nuanced individual treatment plans. And so the typical psychiatrist has a success, or well, SSRIs have a success rate of maybe, 30 to 40%. Placebo effect is 30 to 40% too. I'm not saying SSRIs are completely ineffective, but they're not very effective with just that approach. So we look at the neurological basis of disease and then the integrative things that are damaging those areas of the brain in order to heal those areas of the brain. So our patients are reporting success rates of over 85% now because of those principles.
So everybody gets a SPECT scan done?
Everybody does not have to get a SPECT scan done. Tor gives us a lot more data to work with. So if someone cannot afford a SPECT scan, for example, the Change Your Brain, Change Your Life Foundation sponsor certain applications as well to offset the cost of a scan. If you don't want to do two sets of scans, which is concentrating and relaxing, you can do one set of scans. It still gives us good data. But if you don't want any of that stuff, then you can say, listen, I just want to do a comprehensive psych evaluation with a comprehensive medical history, psych history, and a plan that is not just limited to one tool, namely medication.
So I understand Dr. Amen was a psychiatrist as well. So is most of the practice psychiatry? So I know you do see the brain injury population as well.
Yes, most of us are psychiatrists. There's 13 clinics nationwide now, and we have around 5 to 7 integrative medicine docs who also do Zoom appointments. We don't have any neurologists in our clinics. We're board certified by the American Board of Psychiatry and Neurology. But if there's more neurological concern, for example, if there's a concern for Chiari malformation or a cyst that I'm concerned about, or something else like seizures, then we can refer patients to a neurologist and neuropsychologist, or as we mentioned earlier, neurological chiropractors to look at whiplash or lateral instability. So then we make referrals, say, look, you might have sleep apnea, can order a sleep study. If that's really terrible, you can do an in-lab sleep study at another facility. We were trying to offset the cost to the patient by allowing them to work as much as possible with connected resources through their insurance as well. The goal is to take the guesswork out for the patient, provide them a roadmap, a plan, and answer some questions that they haven't answered yet. So on average, based on the data we've collected, each patient that comes to us has seen at least 3 other psychiatrists, been on at least 5 different medications. So we see some complicated issues for sure, but then we also see people who want to just optimize, make sure that whatever they're doing is correct, maybe streamline the supplement regimens. I'm developing an optimization program for the clinics that we'll be launching this year, which involves brain optimization, performance optimization for my elite athlete population, functioning people as well who want to pull in everything they can to be the best version of themselves. It's exciting times because it's catching on now and people are realizing our environment is not as healthy as we thought.
Yeah, and I might be a little biased doing my show, but I kind of see the rise in functional type of practices as well, because everybody's getting so frustrated with mainstream medicine. It's not answering all their questions.
And not everything can be solved with just a medication. What's the famous saying? If all you have is a hammer, everything you see is a nail.
Yeah. But a hammer does not work for everything, as we're building a fence right now. We have lots of different tools out there as we're putting up this fence, and all of those tools are necessary in the toolbox. And as I'm going through and making all these connections, all of these connections are necessary in our medical toolbox for trying to help our patients get better. So, what we once thought of as inside the box or outside the box just needs to be a bigger toolbox.
100%.
Very
Well,
cool. Yeah, thank you. Do you have any upcoming events or projects or anything that you'd like to share with our listeners?
yeah, well, we just launched the personalized sleep supplement line for Brain MD. It's the first time there's a personalized quiz looking at major sleep saboteurs. One category is the inflammatory kind of sleep situation that sabotages people's sleep. Yeah, there's more of the anxious, OCD, obsessive kind of brains that are trying too hard. And the other piece is more of the ADHD, scatterbrain, busy brain kind of picture. All the supplements are melatonin free. So, we want to cater to kids as well. And that's been really cool. I am also providing content for Brain Tap. It's a device that is used to put you into different states: calm state, sleepy state, concentration, flow state. So they've teamed up with Tom Brady's group. They use acoustic modulation, visual, and tactile to kind of change brainwave patterns. So I'm their sleep guy. So building out some sleep content for their platform. That's super exciting. Better Night does home sleep apnea studies, and they work with national insurances. So any patient to have in any part of the country and get a home sleep test done. So I'm partnering with them on, helping people get more access to sleep apnea studies and building those workflows around that. And of course, the athlete optimization, brain optimization program for BrainMD. I'm presenting at a conference in January called Transform Dental Sleep, because I'm getting my feet wet in the dental sleep space with medical advancement devices for sleep apnea, because those devices work phenomenally well. There's 3 times the compliance compared to CPAP machines. And a lot of my athletes love them because they have to, have a big machine on their face, but also they have to travel with it. They already have stuff in their mouths, for most sports to protect their teeth. So getting more involved in the sleep dentistry world, and it's fascinating. They're 90% effective for even moderate and severe sleep apnea and much easier to use.
Yeah, my husband's getting tested for that right now. When they mentioned CPAP, he said, no. So that'd be an interesting thing to have him consider as well. So very cool. Where can people find you if they want to learn more about any of these things that you're working on?
But my Instagram is Peak Sleep Performance. So you can find me there. Or my website is shanecreado.com. And my email is info@shanecreado.com. And my book is available on Amazon, Sleep Performance for Athletes. And then there's a Kindle version too.
Very cool. Very cool. I'll include those in the show notes so people can find you easier. Um, this has been amazing today. Any last words of wisdom that you'd like to share with our listeners before we wrap up?
I always like to say that God's greatest gift to us is quality sleep. He just didn't give us a user manual. So this is easy. Lock in a wake up time every day, get some sunlight on your face, have a nice winding down time before bed each night, and figure out how much sleep is ideal for you. Maybe on vacation, you found that 8 hours or 9 hours was ideal. You woke up nice and refreshed. Lock that in. It's the single most important thing you can do for your brain health. And remember, it's a modifiable risk factor of the 10 most common causes of death in the world. Modifiable. It's modified and it's free.
I think people forget that modified part of it and they just think, I have my pattern and this is what I do, but we have so much more control than we realize. Thank you so much for your time today. Shane, this has been awesome.
Thank you for having me, Maddie.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.